Hey there, fellow YouTube enthusiast. Today, we're diving into a topic that might make you scratch your head: Quebec's decision not to lower the screening age for colorectal cancer. Now, you might be thinking, why is this even a debate? Well, my friends, it's all about the delicate balance between public health and personal autonomy. So, let's unravel this together. First things first, let's talk about the basics. Colorectal cancer is a serious business, folks. It's one of the leading causes of cancer-related deaths worldwide, and early detection is key to survival. Now, the current screening guidelines suggest that individuals should start getting screened at the age of 50. But here's where things get interesting. In Quebec, there's been a push to lower the screening age to 45. This move is backed by the Canadian Cancer Society, which argues that earlier screening could save lives. They claim that younger individuals are more likely to have a family history of the disease, and thus, catching it early could make a significant difference. But, here's the catch: Quebec's health minister has decided to stick with the current guidelines, citing concerns about the potential risks of false positives and the psychological impact on individuals who test positive at a young age. Now, personally, I think this decision raises some important questions. Why is there such a divide between the medical community and the government? In my opinion, the answer lies in the delicate balance between public health and individual autonomy. On one hand, we have the potential to save lives by catching the disease early. On the other, we have the risk of overdiagnosis and the psychological toll it could take on individuals. What makes this really interesting is the fact that it's not just about the science. It's about the values we as a society hold. Do we prioritize the collective good, or do we value individual freedom? This debate also highlights the importance of informed consent. Should individuals have the right to choose when and how they get screened? These are the questions that keep me up at night. One thing that immediately stands out is the role of patient advocacy groups. These groups have been instrumental in pushing for earlier screening, citing the success stories of early detection. But, what many people don't realize is that these groups often have a vested interest in promoting their cause. It's a delicate balance between advocating for patients and ensuring that the message is accurate and not misleading. If you take a step back and think about it, this debate also raises a deeper question about the role of government in healthcare. Should the government be making decisions about medical guidelines, or should that be left to the medical community? In my opinion, the answer is a bit of both. The government has a responsibility to ensure that healthcare is accessible and affordable, but it should also trust the expertise of medical professionals. A detail I find fascinating is the impact of cultural and societal factors. In some cultures, there's a stigma around cancer, and individuals may be reluctant to get screened. In other cultures, there's a strong emphasis on family health, and early detection is seen as a way to honor one's ancestors. These cultural nuances play a significant role in shaping public health policies. What this really suggests is that there's no one-size-fits-all approach to healthcare. What works in one region may not work in another. It's a complex issue that requires a nuanced understanding of both medical science and societal values. So, the next time you hear about a debate like this, remember that it's not just about the science, it's about the people and the values that shape our society. In conclusion, Quebec's decision not to lower the screening age for colorectal cancer is a fascinating example of the complex interplay between public health and individual autonomy. It raises important questions about the role of government, the power of patient advocacy groups, and the impact of cultural and societal factors. So, the next time you hear about a debate like this, remember to think critically and consider the bigger picture. Thanks for watching, and I hope this video has given you some food for thought.